Hi, this is James C. Davis. Your case is very important to us, and we will work hard to ensure you receive a fair and just recovery.
Hello, this is Samuel Davis. No matter how seriously you have been injured, you can count on us to represent you effectively.
At Davis & Davis, there is no fee for initial consultation, and you don't pay unless they recover for you. Davis & Davis, attorneys at law, helping those who are injured. To learn more, go to davisanddavislaw.com. That's davisanddavislaw.com.
Are you one of the many business owners or managers struggling to find and retain employees? If so, this is an important message for you. The Health Insurance Store has a solution. That's right, the Health Insurance Store. That our licensed and experienced agents put together an affordable package of benefits for you to offer your current and future employees. Are you already providing health insurance? You can add a combination of surprisingly affordable benefits such as dental, vision, short or long-term disability, life insurance, cancer policies, and more. Are you not currently offering health insurance because you haven't been able to afford it in the past? Provisions in the American Rescue Act of 2021 have put the cost within reach for nearly everyone. Plans can cost so little, in fact, you may be able to add other perks that can make your business a more attractive place to work than your competitors. For a no-cost consultation, give the Health Insurance Store a call at 724-603-3403, 603-3403. Call 724-603-3403.
His choice, her choice, their choice is your choice optical.
A new year can bring a lot of new things. If you've been looking for a new eye care provider due to insurance changes or looking for a new look in eyewear, it's your choice. Your Choice Optical in the Nickman Plaza, Lemont Furnace has been serving the Uniontown area for over 25 years. Our professional, friendly staff will help ensure your optometric experience is the best ever. Dr. Dustin Tresser performs a thorough, unhurried eye exam, and the certified optical staff is here to help you choose the best fit in eyewear. Lifestyle, prescription, and budget. Most insurance accepted, and we will gladly help you understand your vision plan. No vision plan? No problem. Your Choice Optical offers discounts for those uninsured. All services are by appointment and office hours are convenient. Your Choice Optical is ready to serve all of your optometric needs. Call 724-438-5120 today. After all, it's your choice.
His choice, her choice, their choice is your choice optical. The right choice.
The views and opinions presented by the host, guests, or callers on this program do not necessarily represent the positions of WMBS Radio.
The Tuesday afternoon here inside our WVU Medicine Uniontown Hospital studios. Brian Morozak along with you, being joined by Dr. David Hess, the president and CEO of WVU Medicine, Uniontown Hospital, and also Josh Kryzik. Josh, of course, the director of community and patient relations at WVU Medicine, Uniontown Hospital. And guys, a beautiful Tuesday afternoon. How are you doing today?
Hey, we're wonderful. Thanks for having us, Brian. Appreciate it.
We appreciate you coming in. And Josh, we mentioned you were in here with us back on January the 25th, a great show, and you told us all the nice things that the hospital's been doing as of late, expansion of primary care, some new physicians that you've added across the region, certainly an expansion of services, and also updated us on the blood situation in the area. And I know you want to do a little recap on that show before we get into the nuts and bolts of this program.
Yeah, absolutely. So I had the pleasure of kind of talking through everything we accomplished in 2021 and what a year it was for us. Despite the challenges of the pandemic, our staff went above and beyond. As we said at that time, they continued to care for the needs of our community while adding so many service lines, so many new physicians, really investing in the community. And it's all, WVU Medicine came in and it was just 100 miles an hour immediately, and it's continuing that way. So it's been extremely exciting. And, we went through all those things, a few weeks ago. But I was really excited to be able to have Dr. Hess join us today and talk about the big stuff that's coming for 2022, because the schedule doesn't slow down. If anything, it speeds up.
And before we get to Dr. Hess, any update on the blood shortages in the area?
I will tell you that our numbers have stabilized just a bit for what our allotment has been from Red Cross. That said, it's still much lower than what we're used to. So again, everybody who's listening, everybody who has the opportunity, do your part. Find a drive near you. Take that time. It's a great way to give back to the community.
And Dr. David Hess, amazing what you guys have been doing at WVU Medicine Uniontown Hospital just over the last year. The expansion of primary care. You opened up the new cancer center, outpatient neurology services. You opened up the WVU Medicine Children's Pediatric Clinic, the Orthopedic and Spine Institute, the Pain Management Clinic, the Pulmonary Care. I keep going on and on and on. I mean, it's just amazing what you guys have been able to accomplish in such a short period of time. And Josh even told us during the last program you're still practicing while all this stuff is going on. And you guys should really be commended for everything that you're doing up there.
No, I appreciate it. Honestly, Brian, the community has been so responsive. And, I've been a CEO now for about 6 years. And one of the reasons that I stay clinical is, if you listen to the patients, they'll tell you what you need. And, as I came and did some reconnaissance work and talked to some of the folks in the community, these folks would talk a lot about, I need more access to primary care. We need more primary care physicians. It's difficult to find a primary care doctor. We're having to travel out of the area for our cancer care. And, I need a neurologist, or, my wife, my daughter has problems with headaches. We need some neurologists in the area. So really it's just somebody that's setting a vision for what truly a regional hub should be, and starting to build those services around what the patients are asking for. And that's really all we did. We put the patients first, we listened to them, and then we started building around primary care, cancer, and orthopedic surgery. And from that, a lot of these other things have spurred off. And this is really a lot of what I did at the former hospital where I worked. We built these services in kind of a stepwise fashion, and just things exploded from there. And that's what we're seeing now at Uniontown Hospital. The perception in the community has really done a 180, and we're really, really excited about that. I think that the more we add and the better physicians that we get there, the better the community responds to us. And then really they never truly leave our area for anything that can be done here locally. So again, we don't stop. We're definitely, I told everybody, the treadmill gets put on 10 and you gotta jump on it running, or you're going to fly off the back. Luckily, we haven't lost anybody off the back of it yet, but we're not going to stop here. We had a tremendous financial turnaround in 2021. We were budgeted to lose a lot of money at the hospital. The hospital had historically lost a lot of money in its recent past, and I'm happy to say that because of the hard work of our hospital and the leadership team, we made money in 2021. The first month of 2022, we've been very profitable. So I think it's been a great financial turnaround. And what we're doing is, you haven't seen a whole lot of changes to the structure of the hospital except for the new entrance. What we're doing now is, with that profit, we're actually investing in the people. So we're raising salaries, we're improving benefits. So, that's going to be our model moving forward, that as we improve financially, it's just to improve the salaries of the people working there, and really a reinvestment in the people in the community.
How much did it help that you've gone through this whole process once before in West Virginia, setting up these lines here in Uniontown?
Yeah, I don't want to say it was a playbook that I wrote elsewhere, because if you've seen one community, you've seen one community. Every community is a little bit different, but I do think there are some core things that community hospitals should be built around. As a primary care physician, obviously, I think that that's the most important thing. I say the primary care physicians are the heartbeat of the community, and the heartbeat of the hospital. And then, a lot of the other things that we've done before in other markets just seemed to take off, and it seemed like it was the right thing to do in this market as well. So it was definitely helpful. I think that we missed a lot of landmines that I probably stepped in at another couple of hospitals where we started this up. But at the same time, I also think that the community was so excited and so receptive for a lot of these things that it made it a lot easier just for that reason as well.
I think it helps a lot, the fact now that we have all of these services basically within a 10 to 15 mile radius of anyone inside the county. As you mentioned before, in the past we had to travel to Pittsburgh or travel down to Morgantown, and right now all of these services right in our backyard.
Yeah, and that's really the mission of WVU Medicine, and specifically Uniontown Hospital. WVU Medicine doesn't go into a community and suck all the patients out of the community and bring them back to the academic medical center. they act more like a blower. So they stick a spoke into a community, and they try to keep as much in that community as they can. And anybody who's tried to seek care at Ruby, they're pretty full on any given day. They don't need to pull more patients down to Ruby. The strength of WVU Medicine's system is really made up of the community hospitals, as well as the strength and financial strength of Ruby. We're only as good as our weakest community hospital, and all of our community hospitals in WVU Medicine are very financially strong. We all are on very good financial footing, and what you'll see is that we tend to build up our community hospitals into regional hubs. That's what we want to make here at Uniontown. That's one of the reasons that we're bringing back delivering babies and bringing back the OB floor again. We think that in our community hubs we can be financially successful with certain service lines, and we think that every community hospital should be delivering babies and bringing babies into the world.
And I think the pediatric clinic and the bringing back of the OB services certainly well received here in the area, because it was something that I think was much needed for the last couple of years.
Yeah, I think that's the one that we hear the most about, and that's been the most exciting for everybody every time I go out in the community, they say, you got to make that hospital better. I was born there. My daughter was born there. And there's an emotional attachment that, the hospital where you were born or your kids were born, you have this attachment to it. And really what we want to do is we want to create the next generation of Uniontown loyalists. Because every baby we bring into this world at Uniontown Hospital is going to grow up in the area and say, I love that hospital. I was born there. They took good care of me. They took good care of my mom or my dad or whatever. So we want that next generation of loyalists, so that in 20, 30, 40, 50 years, when they need a hospital, they only think of Uniontown Hospital.
Again, we're being joined by Dr. David Hess, the president and CEO of WVU Medicine Uniontown Hospital. Josh Kreisig also with us, the director of Community and Patient Relations for WVU Medicine Uniontown Hospital. You mentioned the expansion, and we're even seeing that expansion more outside just the general Uniontown area, moving now into Connellsville and the Scottdale, Mount Pleasant area, as well as south into Masontown and even into Greene County and the Carmichaels area.
Yeah. So maybe it's the West Virginia in me. In West Virginia, we tend to think of things in counties, and I think because we're a smaller state. And so when I think of, the service area for WVU Medicine Uniontown Hospital, even though it's located in Uniontown, I tend to think that the county is our entire responsibility. So we're looking to cover everything from Carmichaels to Connellsville, from Uniontown up to Mount Pleasant, and everywhere in between. We want to have a primary care office in the smaller communities, and we want to have it all connected to Uniontown Hospital in some way. And, I think that we understand the needs of the folks in Fayette County. I think we understand coming from another rural state over in West Virginia. I think we understand the needs and the health care issues that folks in Fayette County have. And we think we're very, very good at addressing those needs, whether it be diabetes, whether it be obesity, hypertension. We're very good at training primary cares. We're very good at placing primary cares in those communities so that they can take great care of patients. And so much so that, as soon as I get my Pennsylvania license, I'll be locating my practice up in the northern part of the county. We think that's a good growth market for us. Some of you may have seen the article in the Pittsburgh Post-Gazette this weekend that talked about Connellsville being a bit of a battleground between us and Excella and Penn Highlands Health System. Again, if you think of this as WVU Medicine's county having the biggest hospital here, we consider it our responsibility. We're going to continue to push north all the way up into that Scottdale area. We have a great group of primary care physicians, Dr. Paul Means and Tiffany Pluto, and we're going to add a third physician to that practice that already has some nurse practitioners in it. And again, that's going to push all the way up near Westmoreland County, but we do feel like if we have a very good product, why not spread it out in the community and in the county a little bit and let everybody have a taste of what WVU Medicine Uniontown Hospital is all about.
It certainly just seems like you're just starting this expansion as much as you've done in the last year. It seems like you certainly have some bigger goals down the line.
Yeah, there's no question about it. I think the physicians that we've been able to recruit here, a lot of them are from UPMC. And it was interesting. The myth that I heard before I came here was you can't recruit physicians to Uniontown. Nobody will come here. They have never been successful at recruiting good physicians. And we don't hire anybody but A players. If I can't find an A player physician, I'm not going to hire them. And we have just found A player after A player. And here's what they tell me. It's beautiful there. Your hospital's beautiful. The community is so nice. They're so receptive. You have so much to do there. The outdoors. Some of our physicians have chosen to live at Cheat Lake and drive up, and that's okay. But we have had no problems recruiting physicians. So as long as we're still able to recruit A-player physicians that I would want to go to or I'd want to send my family to, we're going to keep expanding and growing until we meet that critical mass of physicians that can take care of the entire county. And we'll take it all the way over to Brownsville and the Mon Valley area. We'll take it all the way up to Scottsdale and Mount Pleasant, and we'll take it down as close to the West Virginia line as we need to get to, not to overlap with our colleagues down in Morgantown. But we think that we've got a good thing going. We think that the physicians we're recruiting are buying into our mission. They're not prestige driven. They're very purpose driven, and they want to take great care of patients, and we're giving them the opportunity to do that. And I think that me being a practicing physician and being the CEO is a deal breaker for a lot of those folks. They want somebody that understands what their problems and what their pain points are, and they see that as an opportunity for them to get to work with somebody that understands issues for physicians, and they're signing on, and we're not having any trouble recruiting, that's for sure.
And you continue to be really an economic driver as one of the two largest employers in the county.
Yeah, we're what I saw at my former hospital is we increased our employee count by about 65%. So we almost doubled the amount of employees that were working in the building through growth and through that continued expansion. And that's what we see at Uniontown Hospital. We're already seeing growth. We're already seeing expansion in all these new services. Every time we do that, we have to hire 10, 20 more people for every clinic. I think you'll hear some more announcements coming up of some newer service lines that will add another 20, 25 patients to our roster of employees. And, we're very proud to be a big part of the Chamber of Commerce here and a big part of the workforce in our area. And we're proud to support the community. And I think when WVU Medicine comes into a community, not only do they reinvigorate and revitalize a hospital, but they try to reinvigorate and revitalize the community. I've seen it in other markets where the community may be economically struggling a little bit. WVU Medicine comes in, they get a boost of, our average salary now is $50,000 or $60,000 at the hospital. Those people live in the community, they spend money in the community, and things kind of feed off of that. And that's what we love about coming into smaller communities is not only revitalizing the hospital, but reinvigorating the community through job growth.
And it really seems like no matter what nonprofit event I attend or what fundraiser I attend, it always seems like WVU Medicine Uniontown Hospital is one of the primary sponsors. And just great to see you guys giving back to the community in such a great fashion.
We love that. We feel like that a lot of the fundraisers that are going on line up exactly with our mission at WVU Medicine Uniontown Hospital. And I know Josh does a great job of staying in touch with the community as to what we really need to support and get behind. And I think we just have a recommitment to being that vital part of the community. I think we stepped up during COVID. Our employees just did a phenomenal job at taking care of the community when they needed us. And, I think that giving back to the community is just part of our mission.
You mentioned the reintroduction of the obstetrics and labor and delivery services. We're going to get into more of that in just a moment. You're listening to What's on Your Mind, live from the WVU Medicine Uniontown Hospital studios, being joined by Dr. David Hess, the president and CEO of WVU Medicine Uniontown Hospital, and Josh Kryzik, the director of community and patient relations. We'll be back with more with Dr. David Hess and Josh Kryzik when What's on Your Mind returns here on WMBS.
Jacqueline's Fine Jewelry, the Diamond People.
Jacqueline's Fine Jewelry provides the highest quality gems, jewelry, and timepieces for you. With brands like Gabriel of New York, Stefana, Samuel B., Tag Heuer, Breitling, and Michelle watches.
Jacqueline's Fine Jewelry, the Diamond People.
Jacqueline specializes in diamonds and bridal jewelry. And you can choose your perfect piece in the comfort and privacy of their bridal room. Jacqueline's prides themselves not only on the quality of their jewelry, but also on the quality of their service. Shop Jacqueline's Fine Jewelry, Mount Vernon Avenue, Uniontown, or Suncrest Center in Morgantown, West Virginia.
Jacqueline's Fine Jewelry, the Diamond People.
I'm worried about this winter weather. How are we going to get to the grocery store for the next few months? I'm not too comfortable driving in the snow anymore, and with your disability, you definitely can't drive.
You know, the last time I went to the doctor's office, they're talking about FACT.
FACT?
Yeah, Fayette Area Coordinated Transportation. FACT will come to the house and pick us up. They have fixed routes to places like Pittsburgh and Uniontown, even Nemacolin and Woodlands. FACT also has a shared ride program that schedules you to go to places like the doctor's office or the grocery store.
Well, you know, the grandkids will be at our house when school's canceled.
FACT lets anyone ride the fixed route bus, and children under 12 accompanied by an adult ride for free, as do us seniors age 65 and up.
Wow, FACT might be the right answer for us this winter. Do you have their number?
Yes, it's 724-628-RIDE or factbus.com.
It's a fact, we're Fayette County's public transit.
Hi everyone, this is Kelly Clark with Autoland Hyundai in downtown Uniontown. It's the most anticipated time of the year. It's income tax refund time. Get the most out of your money. Let me show you how. Remember, just a small investment can go a long way. I also can offer you deferred down payments based on your tax refund. So call me direct. It's 724-208-5281 and let me work for you. Kelly Clark, Autoland Hyundai, 724-208-5281. And it doesn't matter whether you're leasing or buying. Give me a call. I'll get you driving. Kelly Clark, Autoland Hyundai, 724-208-5281. 724-208-5281. I'll make you a good deal.
Having Hicks & Baugh's Drugstore in Uniontown means reliability, quality, and service. Pharmacists Stephen Harper and Seth Miller gladly answer healthcare questions and take care of your prescription needs. Hicks & Baugh's also offers Shingrix and flu shots, including flu shots for seniors, COVID-19 vaccines, and booster shots, as well as home tests for COVID-19 self-testing. For more information, call 724-437-2828 for Hicks & Baugh's Drugstore, 304 Morgantown Street, open Monday through Friday, 9 to 6, Saturday till 3, closed Sunday.
WMBS.
Back on What's on Your Mind on a Tuesday afternoon. Brian Morozak inside the WVU Medicine Uniontown Hospital Studios, being joined by Dr. David Hess, the president and CEO of WVU Medicine Uniontown Hospital. Josh Kreisig also in the studio with us this afternoon as well. Josh, the director of community and patient relations at the hospital as well. And Dr. Hess, we mentioned it a little bit earlier, the return of the OB and labor and delivery services certainly has been a big topic and much well received around the area over the last couple of months. Let's get into that and that huge announcement that was made earlier on this year.
Yeah. So that's something that we've been saving. We've been hinting around about it for a couple of months, but we made the announcement and we are incredibly excited about that. I think from top to bottom, that is going to be done the right way. What the way we're going to structure it is that is going to be staffed and run by the OB department at WVU Medicine in Morgantown. So Dr. Leo Brancasio is the chairman of OB in Morgantown. He's recruiting and he's bringing faculty physicians, the same physicians that you would get if you were to deliver at Ruby. They're going to be in Uniontown delivering the babies here. So what does that mean for the community? That means when you sign up for one of the OBs that are going to deliver at Uniontown Hospital, you're going to get the same high quality that you would get if you delivered at Ruby. And with the understanding that if everything goes perfectly, you're going to deliver your baby at Uniontown Hospital just like you wanted to. But if not, if something happens or there's an issue, you're going to immediately be sent down to Morgantown to deliver your baby, but they're going to have all the information on what's going on throughout your entire pregnancy. So the quality that you're going to get in a community hospital is going to be the same as what you would get in Morgantown. So we're very excited that we're going to offer the top quality OB program in the entire region, and it's going to be staffed with the same WVU faculty that you would get if you delivered in Morgantown. We've already spent $1 million on equipment for the new floor, so it's going to be state of the art. We've basically gone down to Ruby and modeled their equipment and have ordered it for our floor. We're hiring a director of OB now to run it from a nursing standpoint. So, and we've got 3 terrific pediatricians already that are out at their office near the Target in Uniontown, and they're just top performers, and I couldn't be happier to have a better pediatrics department. So we're incredibly excited. There's just an energy and a vibe and a happiness and a joy that happens when babies are delivered in your hospital. I mean, even if you're not working in labor and delivery and on the OB floor, when you hear that little jingle overhead that a baby's been born, whether you're working in the ICU and had a rough day or you're working in the ER, you're like, wow, a baby was born. And it brings that excitement, and it spills over into every department. And that's what I love to see about an OB program.
What's the timetable as far as getting it reintroduced?
Yeah, so we're in the planning stages now. From a facility standpoint, the floor is basically already done. We're waiting for the equipment to come in, so we're shooting for September 1st of this year.
Is that going to be in the same area as the Family Beginnings Birthing Center was located at?
It is.
Okay.
It is. So the OB clinics will be inside of the hospital. But the labor and delivery floor will be at the same location it was before.
And you mentioned earlier the fact, all of these expansion of services, and I'm sure that really means that you're looking for a lot of folks to continue to work at WVU Medicine Uniontown Hospital.
Yeah, so, we're like every other industry right now. We're running into staffing issues, and we've just got, over 100 job postings at any given time, from nursing to housekeeping to dietary. So, we think we're very, very competitive from a salary standpoint, but really where we set ourselves apart is on the benefit side. Our health insurance is top notch, and really the thing that I'm proud of the most for working for WVU Medicine is that, we try to treat everybody that works for us with the most respect and the most admiration. And in doing that, we try to build up their families. So, we have a program now that no matter where you're working in the hospital, whether you're a bedside nurse, whether you're in dietary, whether you're in housekeeping, whether you're in laundry, we will pay for your children to go to WVU for free.
Wow.
So, that's something that we felt very committed to do, we felt was very important, and we felt that was going to set us apart from some of the other employers and to try to attract talent is, you come here, we're going to give you a good living, and oh, by the way, we want to make sure that we educate the rest of your family as well. So for me that has 6 kids, it's a big benefit. All my kids can go to WVU for free. So, but we do that for everybody that works for WVU Medicine, and we're very, very proud of that. That's just a commitment that we want to make not only to our employees, but to their families, because we know that they make a lot of sacrifices, and we want to make sure we also reinvest in their children as well.
That's basically over $100,000 sign-on bonus per child.
It absolutely is. I mean, it's a huge benefit for everybody to know that, I don't have to scrimp and save for my child to go to college, nor do they have to get burdened with all the student loan debt. The hospital is going to pay for them to go to WVU and get a great education, and I'm not going to have to worry about it. And we think that is a differentiator for us to be the employer of choice, which is what we're trying to do. But yeah, we've got a lot of job openings now, and I know that as the weather's getting nicer, we're hoping that more and more people are looking to get back into the workforce and coming back, and we're hiring. We're like everybody else. The sign is up, and we're wanting some good people to join this exciting ride that we have. Everybody wants to join an organization that's growing and has got a lot going on, and that's definitely us right now.
What's the best way for folks just to maybe find out more, whether, no matter what the field is, whether they want to be a doctor at the hospital, nurse, as you mentioned, housekeeping, or any other line? What's the best way to go about that and apply?
Yeah. So if you go to wvumedicine.org, you can go to their career section, or you can just go to our website directly at uniontownhospital.com.
Yeah, absolutely. At the top of our website, it's right there available to you. It says employment opportunities. It breaks it down for you by category, by department, part-time or full-time. And as Dr. Hess said, one of the things that we really think sets us apart from some of the other opportunities out there is a lot of things have risen to the top and given you some incentives based around COVID. But in a lot of those places, those things are going to start to go away. The investment here, the investment by WVU Medicine in its people isn't going to go away. You're going to be invested in your entire career, and it's really where you can get started and really, set a foundation for yourself and for your family.
And I can't think of too many employers out there that actually pay for their child's education.
Yeah. Yeah, I think we're one of the only ones that we've heard of. We made a deal with the university to be able to pull this off, and we just felt super committed, and we knew this would be something that would set us apart. And I think Josh brings up a good point. We have a lot of people that just get their foot in the door at Uniontown Hospital, and then we pay for them to go to nursing school, we pay for them to go to RN school, we pay for them to get their MBA or some other advanced degree. We hope that they stay with us or stay within the health system, but it's an awesome place to join no matter at what level you join the organization. And we really cultivate and help you to grow and advance in your career, whether that's at Uniontown Hospital, at somewhere else in the health system, or, we don't want to lose you, but certainly as long as you left our place better than when you got there, that's all we can ask from you. Even if you leave the organization, we're good with investing in everybody that works for us.
Again, we're being joined by Dr. David Hess, President and CEO of WVU Medicine Uniontown Hospital, and Josh Kryzik, the Director of Community and Patient Relations. And you mentioned some of the other specialty care services that you've opened up during 2021. Anything else planned for 2022?
Yeah, we've got a lot planned for 2022. So we just opened up our new sleep clinic. Sleep medicine is something that's growing as a specialty. So basically anybody that struggles with fatigue, especially during the day, they fall asleep a lot during the day, especially on a rainy day if C-SPAN or something boring's on. So all those patients should really get a sleep study done to rule out sleep apnea. And our second biggest referrer to the sleep clinic is, a lot of our patients that have heart issues, whether it be heart failure or heart rhythm problems like atrial fibrillation, the heart specialists are saying all those patients should get a sleep study. So we knew that a lot more people needed sleep studies done, so we opened up a sleep clinic. We hired away UPMC, one of their top lung specialists, Dr. Pete Kachapura from UPMC Passivant. He is now the chairman of pulmonary and sleep in critical care at Uniontown Hospital. He opened up a sleep clinic this month, and it's already been very, very busy. We've already had patients getting some sleep studies done. So, that's on tap. So we've hired 2 more pulmonary specialists to join him and grow that department. You'll see further expansion in primary care, certainly to the northern part of the county as well. I think you'll see us getting into other specialties that are in high demand. Again, we listen to everybody in the community, and when they say, "Hey, I need this specialist," we go out and get them. We have we hired a neurologist last year to join one of our other neurologists. We had 2 neurologists. We have a third one starting next month, Dr. Angela Liu from UPMC. She's phenomenal, and I think that's a growing specialty that you'll see. We'll probably add a 4th neurologist. We started up our spine surgery center here, so that spine surgeon continues to grow. And then of course OB later on in the year is just going to be our marquee program to open in 2022. So, a lot of what we're doing with primary care and a lot of expansion into the north, but then we'll add on some more neurologists and bring back our OB program.
I think now's a great time as well to maybe get reestablished with a primary care doctor within your network.
No, that's a great point. I think one thing that COVID has taught us, there was a lot of misinformation out there. There was a lot of lack of information. And I know a lot of people were reaching out to me personally and asking me questions as to which way to go, what should I get treated with. You bring up a great point, right? I mean, this is the perfect opportunity with us having tremendous new primary care physicians in the area. Please land with a primary care physician, because it may be COVID this time. Next time it may be another virus, or it may be another challenge that we always need to have a primary care physician as a quarterback for our health care, so that we can call and say, hey, do I need to get this done, or should I get this looked at? That's what we're there for. Sometimes we can help you, and that's the end of it. Sometimes we're the gatekeeper to say, no, you need to see this specialist or that specialist. That's something serious. But I think if COVID has taught us anything, is there's a lot of bad information out there, and sometimes you just need to go to an expert to help you sort through that information, and that's everybody's primary care physician. So we all need that touch point and that home base to go to if need be.
And you mentioned earlier you're looking at beginning to move your practice as well to Fayette County in the coming months. Tell us a little bit about your background and where you got started.
Yeah, so I was a graduate at WVU Medicine in medical school, and then I went to the University of Kentucky in Lexington. I did a residency in internal medicine, which is a doctor for adults, and a residency in pediatrics. So I see primary care from basically cradle to grave, all ages in between. And so I'm an internal medicine doctor mainly, and see a lot of adult patients in my outpatient clinic. We talked a lot about Connellsville being a growth market for us. I thought it was so important of a growth market for us that's where I'm going to put my primary care practice, is in Connellsville. And I've been doing primary care now since 2002, since I came out of residency. And so I have 20 years of experience. And a lot of patients that I've seen over that time. I've been very busy over in the northern part of West Virginia, so I am very excited to bring my skill set over to Southwest Pennsylvania, start taking care of some of the patients in Fayette County, and like I said, more than anything, it gives me the opportunity to connect with the community and listen to what's important to them.
You mentioned as well the expansion of services not only into the Connellsville area, but you guys are moving into the Mon Valley as well.
Yeah, we're very excited. I think we've recruited Dr. Gina Canada, who was a resident of Connellsville for a long time. We've moved her into Carmichael's. And then now we're moving up into the Mon Valley area. We're looking at doing some things in the Brownsville market, and also, other places that we're looking at strategically in that kind of northwestern part of the county. And again, we're excited. We think if there's an opportunity, we're going to look at it and discuss it and move into there. And we think that having primary care physicians sprinkled throughout these smaller communities is a great model for us. And certainly as a primary care physician, I think that the patients would want to have somebody that close to their home, not have to travel.
Let's talk about the Brownsville market. There was a time Brownsville had their own hospital, and it's been a while, and it seems like those folks up in that area sometimes struggle to find care.
No, I agree. I drive by it every day coming in from work or coming into work. And, I think that when you look at a community, a lot of times it's schools, church, and healthcare kind of define that community. And, I know that that's a very proud community. I know that that's been a very strong community. And when you take away one of the pillars of the community like that in healthcare, it leaves a void, it leaves a sting, and it leaves a hole in the community. And I think we're just the right people to kind of fill that void and fill that hole. So, we're definitely looking to move into that part of the county and make sure that they have great access to health care.
And it really seems like you guys have gone above and beyond as far as trying to recruit some of these world-class physicians from not only just around this area, but from around the country.
Yeah. And again, you would be surprised. We've had them come from Chicago. We've had them come from, obviously Pittsburgh and Morgantown, but they have literally come from all over the country, all over the world to want to live here. And it's interesting, one of my favorite physicians at the hospital, will tell me all the time, Uniontown Hospital has the best of both worlds. You're close enough that you can be in Pittsburgh and you can do bigger city things. You're close enough to an international airport that when they want to go to bigger cities, they can be in the airport in an hour and be, on the plane flying somewhere. But at the same time, it's a wonderful, beautiful, relaxed feel to be in Uniontown. There's so much natural beauty and outdoors activities for them that they feel like it's the perfect mixture for a busy physician to have access to a lot of things that they want, but also for their life to slow down a little bit and be able to enjoy the outdoors. So I agree with them. I think Uniontown has been wonderful to me professionally, personally. It's been a great recharge for my career. And I think just connecting with this community has been incredible. There's a lot of great people here with a lot of good ideas, and we're feeding off of that. But again, just to drive in every day, and I think maybe when you're from here, you forget how beautiful this place is. But coming over the hill and into Uniontown is just a magnificent view for me every day. I come in off of 43, and I'm just like, wow, that last little dip that I come over and dip down into the community is just like it's almost breathtaking every day. And I think that this is a wonderful place for a lot of these physicians to want to locate.
What's your 5-year vision for the future?
Yeah, 5-year vision, I tell everybody, Uniontown Hospital needs to grow into the hospital that it should be based on the community this size. And, a lot of people don't realize that in Pennsylvania, Fayette County may be a smaller county. If Fayette County was in West Virginia, it'd be our second biggest county behind Kanawha County, which is where our capital is. So for us, it's a big deal. For us, meaning WVU Medicine, we want to invest in this market. We think that, we know markets that are this size. And we think that Uniontown Hospital, quite honestly, should be bigger than it is for a county of 130,000 people. So the 5-year vision for the hospital will be to grow from 135, 140-bed hospital probably into about 180 to 200-bed hospital. And it's going to be a lot more outpatient services, and it'll be a lot more clinics all around the county. So it'll be focused a lot about growth.
Certainly a lot of excitement for the future, continued growth and expansion. And again, you need people. You're expanding to all these services, expanding all these clinics. You need people to work.
We would love for people to work. Please visit our website, put in an application. We need people from all walks of life. Whether you're clinical or non-clinical, we will find a spot for you. We want to challenge you. We want to invest in you. We want to educate you and make you the person that you want to become. I mean, we're all about investing in our employees and trying to do what's best for them. And yes, we're absolutely needing anybody and everybody that wants to work because we're ready to grow.
You mentioned the sign-on bonus. There's opportunity for your kids to go to school free at WVU, and you're investing in everyone's future.
Yeah, we're trying to invest in the county, and we're trying to raise up everybody in the county that wants to work. And again, I think that every parent out there, this hits home when you can make sure that you leave a legacy for your child, and that legacy be a higher education or a degree somewhere. You've done your job as a parent, and I think that's really hitting home with a lot of people that are looking to us to become employed is that, okay, we want to get you here, but we also want to reinvest in your children and make sure that they have a great future as well.
Dr. David Hess and Josh Kryzik joining us here on What's on Your Mind inside our WVU Medicine Uniontown Hospital studios. And guys, great information. The hour's just flown by. Anything you'd like to leave us on here? And I'm sure we'd like to do this again here sometime soon.
No, the only thing I'll say, Brian, is that this community has been incredible. And we're looking to do bigger and better things for 2022 and look for more growth and more services that we'll add at WVU Medicine Uniontown Hospital.
And Josh, always nice to talk with you as well.
Absolutely, Brian. My pleasure.
Again, that's Dr. David Hess, President and CEO of WVU Medicine Uniontown Hospital, and Josh Kryzik, the Director of Community and Patient Relations. Guys, it's been a fun hour, and hopefully we can catch up again in a few weeks.
Thank you, sir.
Definitely. Thank you for the opportunity.
Yeah, this is What's on Your Mind here on WMBS Uniontown. Stay tuned, CBS News on the way in just a moment.
Chestnut Ridge Counseling Services understands that during this time of social distancing and uncertainty, you may feel anxious or scared. If those feelings are interfering with your daily routine, please reach out to us. Chestnut Ridge Counseling Services is open and seeing people like you over the phone, via FaceTime, or for very urgent needs, in person with the appropriate safety precautions. Chestnut Ridge Counseling Services has open access mental health urgent care with immediate access to a mental health professional with no appointment necessary. Call us today at 724-437-0729 to learn more about this new, convenient, and safe opportunity to get help, or visit our website at crcsi.org. Chestnut Ridge is here now when you may need it most. Call us today at 724-437-0729. Visit crcsi.org or follow us on Facebook for tips to get through this crisis together. Stay safe.
The North Union Township Recreation Center and supervisors are a proud sponsor of the Laurel Highlands Mustangs basketball team. The North Union Rec Center and supervisors wish the Mustangs good luck on their road to the playoffs. For information on the Rec Center's basketball and soccer leagues, please call 724-438-7350 or visit their website at northunionreccenter.com.
The WVU Medicine Uniontown Hospital Orthopedic and Spine Institute is open, and their experienced providers are ready to care for you. Orthopedic and spine care spans a wide range of problems, from arthritis to joint trauma caused by injury or overuse. Hips, shoulders, knees, and backs are the most common areas where patients experience pain or impaired function. At WVU Medicine Uniontown Hospital, they can treat orthopedic and spine problems with state-of-the-art care. Their board-certified orthopedic surgeons and specialists are well experienced in the latest treatments for damaged and diseased joints. They offer everything from physical therapies to joint repairs and joint replacements. Whenever possible, the newest, minimally invasive techniques are used to ensure quicker recovery, less pain, and less damage to surrounding tissues. To learn more about the newly opened Orthopedic and Spine Institute at WVU Medicine Uniontown Hospital, or to schedule an appointment, call 724-912-7533 or visit wvumedicine.org/Uniontown. WVU Medicine Uniontown Hospital. The new us, here for you.
What's it like to be a medical marijuana patient at My Tree Medicinals in downtown Uniontown? Here's what our patients are saying.
The staff goes out of their way to help you. They're friendly, polite. I mean, you couldn't ask for more, really. Because if it weren't that way, I wouldn't be here.
The staff here at My Tree were great.